Okay, I know we've still got some people checking in, but I want to get started and respect everybody's time. So welcome to Exemplify number 6. I'm Melissa Maloney. I do have a cold, so I apologize. And I'm the Chief Operating Officer of SelectPath. And we're really excited to bring this session to you today. This has been a session that's been in the works for a couple of months. And I'm just really excited for the information that Karma's going to share. So I'm going to introduce Karma and then I'm going to pass it over. So Karma has worked for several years across the continuum of care, providing direct bedside care in acute care hospitals, emergency room care, community care, and administrative clinical support. She is passionate about patient advocacy, health teaching, and access to care for individuals. Karma is a member in good standing with the College of Nurses of Ontario. She is TEACH, which is Training Enhancement in Applied Counseling and Health certified through the University of Toronto and CAMH. So really excited. I'm going to pass this over to somebody who sounds much better than me today. And Karma is going to teach us all about wellness and sleep hygiene. And I'm super excited. So welcome, Karma.
Thank you, Melissa. Thank you. All right, I'll just share my screen here with everyone. All right. Just to confirm, Melissa, can you see my screen? We're looking good.
You look great.
Perfect. Thank you. So welcome, everyone. I'm really excited to share this information with you today. And as Melissa said, this is something that I'm very passionate about. So in this webinar today, we will explore how sleep hygiene, dietary choices, and physical activity can positively influence our mood and our health. We will discuss various factors that can impair sleep quality, including medications, lifestyle choices, and medical conditions, and also the necessary nutrients needed to improve our mood and the dietary recommendations to increase the intake of these nutrients. We will take a moment to explore strategies of self-compassion, meditation, and ideas to incorporate movement into our day to improve our mood. So perhaps you've heard the expression, don't eat your feelings. Well, you may be surprised to learn that the food we eat can actually have an impact on our mood. As we attempt to navigate the changing landscape of our world, modifications to our routines, and perhaps uncertainty about job security and our health, we may feel less in control of our moods and our emotions than ever before. It's these increased challenges that may have caused us to make unhealthy food choices and perhaps adopt a more sedentary lifestyle. In fact, 30% of Canadians have reported gaining pandemic pounds. But why? How does staying home make us gain weight? Well, as the country pivoted to a new work style, adjusting to working from home or perhaps a hybrid working model, our routines and even our eating habits have changed. Working from home, the kitchen only a few feet away from our desks, has made it all too easy to stop for a quick snack of crispy chips, delicious chocolate, or other snacks throughout the day. And these choices that we make are often related to our stress levels. So let's examine a few hormones that may contribute to weight gain and food cravings. So what is the role of stress in weight gain? Well, most of us agree that the past 2.5 years have created unprecedented levels of stress. When humans feel an increased level of stress, our tendency is to crave high-calorie comfort foods. And this is due to the biological fight or flight response. Cortisol, which is the stress hormone, is secreted by the adrenal glands and released when an individual feels duress. cortisol can impact our appetite as it binds to receptors in the brain, causing cravings and an increased desire to eat. As our body prepares to fight or flee, it craves carbohydrates or sugar to prepare our muscles for battle. Our body doesn't know if we're preparing to fight a bear or struggling to find a new daycare. All it knows is that we are under attack. And our brain, when under acute stress, actually requires around 10% more energy. So we try to supply that energy with quick, easy sugar sources like carbohydrates. Now, studies have shown a direct correlation between increased cortisol levels and calorie intake, particularly in women. So let's add another hormone to the mix, insulin. As we indulge in these high calorie, high carbohydrate comfort foods, our body must release higher levels of insulin to help manage that elevated blood glucose and to keep our body balanced. But ironically, insulin can make us feel hungry, and we create a vicious sugar craving cycle. In fact, elevated insulin levels actually make our food taste sweeter. So as our levels rise, we have a heightened perceived pleasantness of sweetness, so that chocolate tastes even better. Being aware of the role that these hormones play in stress, cravings, and hunger can help us be more mindful of what is happening within our bodies and understand why we might be feeling the way that we feel. Some may feel like they have little to no control over their health these days. So engaging in physical activity is a great way to take a proactive measure toward your health. With changes to many fitness facilities' schedules, the slow return to in-person workouts, or perhaps you don't yet feel comfortable returning to the gym, options to work out and even motivation may have become a challenge, and healthy habits difficult to maintain. I encourage you to be mindful of movement. Exercise makes us feel better overall. Why? Well, physical activity releases a number of hormones, including endorphins and serotonin, the happy hormone, which is well known to improve mood. Being active gives us an overt way of doing something healthy for our bodies that is in addition to all of the other health measures that we're taking, like frequent hand washing, masking, physical distancing, and vaccination. Serotonin also assists with healthy digestion and sends messages to the brain when you are full. It may be helpful to reframe your outlook. So perhaps some of us are finding some extra time in our schedules to fit in a workout or a yoga regime as we pivot to a hybrid work or work from home model. Or quite the opposite might be true. You might find that you're now carrying a greater responsibility than ever as you juggle last-minute childcare arrangements, working from home, maybe even more housework with more people in the house, and struggling with that work-life balance. So how can we incorporate activity into our day? There are many workouts available online, and several gyms offer virtual classes. I would suggest that you consider challenging yourself and your friends with a social media challenge, such as the hashtag push-up challenge. Connect with a workout partner online and try to schedule movements into your work calendar, really short fitness breaks. A new fun trend is the virtual city scavenger hunts that get you out walking and exploring the outdoors. And certainly if you can, I encourage you to take your exercise outside. There is clear evidence to support the connection between bright light and sunshine and serotonin production. Another way to incorporate movement into your day is to practice joyful movement. Joyful movement is an approach to exercise that emphasizes finding joy and pleasure in all the ways that we can move our bodies. It's exercise for the purpose of feeling good, being healthy, and having fun, instead of being solely focused on burning calories. Joyful movement is really any positive experience that you choose that encourages awareness of your body and the possibilities of movement. This practice means moving your body in a way that feels good, rather than a punishment that you have to suffer through. And you'll notice some pictures I'm sharing of my own family here. And I love this picture in particular of my daughter because you can see that pure joyful movement in her face as she participates in this activity. So let's turn our attention now to food and talk about a few vitamins and minerals that can help lift our spirits. And for this, we don't need to look any further than the grocery market shelves. Researchers have studied the association between food and the brain and identified nutrients that can boost or regulate our moods. So let's examine a few. So we've just talked about the positive mood enhancing effect of serotonin. So you might ask, tell me, what foods can I eat that have serotonin? Well, there's no way to add serotonin directly through your diet. There are foods that we can eat that boost serotonin production and facilitate serotonin uptake. So let's explore a few of these. An example of a serotonin boosting food are those that contain tryptophan, an essential amino acid that aids in the production of serotonin. Tryptophan is not produced by the body, so it must be added through diet. Good sources of tryptophan are shown here. Optimizing vitamin D levels can spur the conversion of tryptophan to serotonin. So it's important to include vitamin D into your diet. High levels of vitamin D can be found in food sources such as fish, and those that do not eat fish can obtain similar levels of vitamin D in eating the eggs of free-range chickens. Those eggs that are produced actually have higher levels of vitamin D from the chicken's exposure to the sunlight. Or you could choose eggs from chickens whose feed has been enriched with vitamin D. Wild mushrooms or mushrooms that have been exposed to UV lights are really the only significant natural plant-based sources of vitamin D. Additionally, commercially prepared foods are often fortified with vitamin D, and consumers may find vitamin D fortification in foods such as cow's milk, orange juice, soy milk, and cereals. Another dietary helper in serotonin regulation is the vitamin folate. A lack of folate in your diet can cause lower levels of serotonin and fatigue. Now, fortunately, folate can be easily added through several dietary options, including some of the delicious food sources shown here. Now, chromium is really a trace mineral that's found in small amounts in the body, but it's actually a powerhouse in mood regulation. It works to regulate the hormone insulin and plays an important role in serotonin production by allowing tryptophan to enter the brain. Excellent sources of chromium can be found in these food sources. So you may be asking, why not just get this support through supplementation? While supplements are a potential adjunct to a healthy diet, our talk today is really focused simply on getting these essential vitamins and nutrients through our food. There may be risks associated with taking too high of a supplementation, magnesium, for example, so it's important to talk to your physician to assess the need and the safety of adding supplements to your diet. Now, lots of press is given to the B vitamins, and for good reason, specifically vitamin B6 and vitamin B12. B6 helps regulate our brain function and influence our mood. The recommended daily allowance of vitamin B6 for adults is 1.3 milligrams per day. And guess what? 1 cup of chickpeas contains 1.1 milligram, which is almost the full recommended daily amount. Really an easy and a delicious way to eat happy. B12 plays a vital role in synthesizing the nutrients that are essential for that healthy neurological functioning. The total recommended daily requirement for B12 can be found in simply 1 serving of these foods shown here. There's very interesting and promising research that suggests that healthy fats, like omega-3s, may contribute to improvement in mood. 2 omega-3 fatty acids, EPA and DHA, work by traveling through the brain cell membrane and interacting with mood-related molecules within the body. They also play a role in the anti-inflammatory process, which has been shown to decrease depression symptoms. Now, the body cannot produce its own omega-3s. These must be supplied through diet. Some good sources of omegas can be seen here, including seeds. And a great way to introduce seeds into your diet is to sprinkle them on your salad or add them to your smoothies. Proteins are made up of essential amino acids and really considered to be the building blocks of life. Many of these essential acids are produced naturally in the body, but some must be provided through our diet. Several of the neurotransmitters in the brain are made up of amino acids, so a lack of these essential acids can really affect our mood and our ability to regulate our behavior. Studies support increased protein throughout the day actually reduces preoccupation with food thoughts and increases evening and late night fullness, which does help reduce late night trips to the snack cupboard. Magnesium is a mineral that supports and promotes the maintenance and protection of our body's health. It is involved in over 300 chemical reactions in the brain, and it's a big contributor to regulating emotion and promoting a sense of well-being. Magnesium also improves sleep quality and supports that deep restorative sleep. Really nothing like a good night's sleep to help with stress reduction. My mom always told me to get a good night's sleep and I would feel better in the morning. So we've talked about the importance of vitamin D in our diet, and vitamin D activates the neurotransmitters that release serotonin and dopamine. Unfortunately, in our Canadian winter climate, shorter days and less time outside significantly reduces our vitamin D. In fact, studies show that 70 to 97% of Canadians have insufficient vitamin D levels. Fortunately, the weather's getting warmer, and today being the first day of summer, in Canada, the best exposure to vitamin D from the sun is during the spring and summer months, between 10 o'clock and 2 o'clock, when the UV index is higher than 3 and your shadow is shorter than your height. Now, casual exposure of 5 to 15 minutes a day during that time is generally enough to produce enough vitamin D. However, if you're planning on spending longer time in the sun, please remember to apply your sunscreen. Alternately, you may wish to add vitamin D through the dietary sources that we reviewed earlier, or through the use of a sun lamp. Lower vitamin D levels can result in individuals feeling depressive mood symptoms, increased lethargy, and a lack of motivation. Another strategy that is helpful when considering food as it impacts our mood is to have a consistent meal schedule. Eating at regular, expected times sends the message to our minds and our bodies that our nutritional needs will be met. I always like to say it's sort of like making and keeping a promise to ourselves. The practice of intuitive eating is really helpful to help repair or maintain a healthy relationship with food. Intuitive eating involves trusting your body, listening to your body's hunger cues, and honoring those needs. It is helpful to check in with your body and determine what you're feeling. Are you hungry? Are you tired? Are you bored? Are you feeling stressed? Really give yourself that unconditional permission to eat. Food does not have a moral value. Avoid thoughts like, I shouldn't eat this, or that's a bad food. Rediscover satisfaction in your food. I love this picture of my daughter here, and just so you know, she did provide her consent for me to share it, because you can really see that pure joy on her face as she gets ready to enjoy this treat. Seeking satisfaction from food is an important part of our human experience. It's also important to recognize fullness. So this may mean having a second serving because your body is not quite full, or it may mean not finishing everything on your plate. I encourage you to practice mindful eating. And this involves being present in the moment without judgment of ourselves. Practice focusing awareness on your feelings and the emotions that we associate with food intake. Now, what about snacking? Many of us enjoy crunchy snacks, and there are certainly ways to incorporate healthy snacks that satisfy that need to crunch. So some tasty snacks that you may wish to try are roasted pumpkin seeds. These are high in protein, iron, and magnesium. Another excellent choice is baked kale chips. These are a delicious, crunchy snack, high in vitamin A and vitamin C. Or perhaps you'd like to try toasted edamame. 1 cup serving contains 17 grams of protein, 8 grams of fiber, and is a delicious choice. Or you may wish to make a choice like my daughter with this brownie sundae and caramel popcorn. This is really the time to practice self-compassion. It is very important to remember that food is about balance and not perfection. If you're unable to source fresh fruits and vegetables, frozen ones are a great option. Frozen fruits and veggies are nutrient dense and a terrific way to create that balance on your plate. Some options for incorporating frozen produce into your day include smoothies, frozen fruit as a snack, adding frozen veggies to the rice or the quinoa, or cooking with frozen spinach in quesadillas or pasta. A popular trend that you may not have considered is to roast frozen veggies. Consider adding them to dishes that are already flavorful and those where the softer texture isn't going to take away from the dish. Frozen versions are budget friendly, and they certainly can save time on prep work. Other options, of course, include the vastly popular meal kit delivery services, which often include fresh veggies and new ideas. So now that we've explored how we can improve and regulate our mood with diet, let's turn our attention to our sleep habits. Perhaps you've lived or worked with someone who is grumpy and irritable, and you attribute this to waking up on the wrong side of the bed. We all know that a good night's sleep can have an overall positive effect on our mood. But how can we get a proper sleep or improve our sleep hygiene? Those who struggle with sleep interruption may find that they also struggle with concentration and memory. Deep sleep is really vital in supporting declarative memory. That is the processing and consolidation of new information, which help forms the long-term memories, allowing you to remember particular facts and events. So if you're trying to absorb new information, such as when studying for an exam or maybe learning a new task, part of that process should really involve good sleep habits. The Journal of Sleep Research suggests that sleep deprivation reduces the specific ability to share the emotions experienced by others. It's this emotional or affective empathy that gives us the ability to understand another person's emotions, to respond in an appropriate manner, and to build those meaningful emotional connections. So this really explains why we might feel more impatient and less empathetic to those around us after a night of interrupted sleep. We don't have the capacity for that emotional or affective empathy. Another side effect of reduced sleep is increase in anticipatory anxiety. And I think we've all suffered with that from one time or another. This is when we find ourselves worrying about things that have not yet happened or anticipating worst case scenarios. Researchers at UC Berkeley have shown that a lack of sleep activates the areas of our brain that contribute to excessive worry. This effect, of course, is heightened in those who already struggle with anxiety disorders, and it can certainly add to their stress. Sleep and our mental health is a two-way street. Not only does sleep disruption impact our mood and our mental health, but those struggling with mental health concerns may also find that their sleep is impacted by their anxiety, their depression, or another mental health condition. A lack of sleep can feel like being stuck in a circle of despair, anxiety, anger, and difficulty concentrating. There is direct evidence to support a link between chronic insomnia or other sleep disorders with an increased risk of developing depression and anxiety. Having a poor night's sleep can have a greater impact on your life than simply feeling grumpy in the morning. Studies have shown that a lack of sleep can seriously affect your health. So not getting enough sleep can cause your heart rate and your blood pressure to rise, placing you at greater risk of heart disease and stroke. During sleep, blood pressure naturally decreases. This process is known as nocturnal dipping. And so a lack of sleep or poor sleep does not allow for this natural dipping, therefore resulting in elevated blood pressure. For individuals who do not get sufficient sleep, even after only one night, the body changes the way it processes glucose and it exhibits increased insulin resistance. So of course, this can result in an elevated risk of developing type 2 diabetes if left unchecked. Getting a good night's sleep can also reduce your chances of getting sick and increase your recovery if you do catch a cold. When we sleep, the body releases proteins called cytokines. Now, certain cytokines are needed to reduce inflammation, and they're used when you're sick or under stress. Lack of sleep prevents the release of these necessary protective proteins. Those that do not get enough sleep are also thought to produce altered levels of the hormones that are responsible for regulating appetite. When sleep is poor, the body has reduced levels of leptin, the hormone that signifies fullness, and increased levels of the hormone that stimulates hunger, which can, of course, result in the potential increased risk of overeating and obesity. The good news is that, like our diet, there are many strategies to improve sleep hygiene that can have a positive effect on your mental health, your physical health, your outlook, and your ability to face the day with a more empathetic approach. Let's explore some of these strategies to help improve your sleep hygiene. First, let's start by creating a bedtime routine. Having a nightly routine sends cues to the brain that you're preparing to sleep. Choose an activity that promotes feelings of relaxation for you, such as meditation, reading, journaling, or a warm bath. It's important to start your routine 30 minutes to 2 hours before sleep, so your body has a chance to wind down. Now, once you pick a specific time for bed, stick to it, even on the weekends. This allows your body to get used to a regular sleep rhythm. This tip is especially important for those that work fixed night shifts. What about those that work rotating shifts? And I know this from nursing in the hospital. These shifts can make maintaining a good sleep routine very difficult. Those that work rotating shifts should prepare for a new shift schedule by actually shifting their sleep time. This can be done by delaying bedtime 1 to 2 hours each day prior to the shift change to allow the body to prepare for the change. This gradual adjustment allows the body to still get enough sleep and prepare for the upcoming change. When discussing food and mood, we touched on some of the natural hormones that our body uses. Well, exercise releases hormones that are essential for the production of melatonin, the sleep hormone. The best time to exercise for earlier and better sleep is early afternoon. This causes an increase in melatonin production later in the day. Exercising less than 2 hours before you plan to go to sleep can actually impair your ability to fall asleep. An added benefit of exercise to improve sleep quality is, of course, the natural reduction of stress due to serotonin production that we talked about earlier. When we work out, we have less stress, which means better sleep. Another factor for consideration when talking about exercise as it relates to sleep is that those who maintain a healthy weight are less likely to suffer from obstructive sleep apnea, which can cause severe disruption to your sleep. It is important to ensure that your bedroom is neither too hot or too cold. For most people, the best quality of sleep will be experienced in a cool room with a temperature between 16 to 20 degrees Celsius. This mimics the body's natural decrease in body temperature that occurs while you're sleeping. Can food impact our sleep? Well, there is some truth to the belief that a warm glass of milk will help you sleep better. We've already discussed the importance of minerals, vitamins, and hormones for mood regulation, but foods can also be used to improve sleep. Foods containing calcium, magnesium, and tryptophan help the body produce melatonin. So try a glass of milk, banana, or oatmeal before bed. Avoid foods that are heavy, sugary, or spicy. Eggs are popular in the morning as a breakfast food, but they can also make you sleepy since they have tryptophan. So try having some breakfast for supper and see what happens. Nuts and seeds such as walnuts, flax seeds, pumpkin seeds, sunflower seeds, all boost melatonin levels since they too contain magnesium and tryptophan. Studies have shown that those who use coffee, alcohol, or nicotine in any form within 4 hours of going to bed experience significant negative effect on their quality of sleep. Now, nicotine can be particularly impactful for those who may struggle with insomnia because research shows that those with insomnia who used nicotine had a 40-minute reduction in overall sleep throughout the night. And although you may feel that having a few glasses of wine before bed will help you sleep, the reverse is actually true. Alcohol may cause you to fall asleep faster. However, it reduces the quality of deep, restorative REM sleep. Disruption in that needed REM sleep can in turn cause daytime drowsiness the next day. If you choose to use marijuana, you might say, but weed helps me sleep. There is very limited research that explores the effect of marijuana on sleep. However, what is known for certain is that marijuana changes our sleep architecture, or the time that's spent in the different stages of sleep. Heavy, regular use results in less time in deep sleep and less REM sleep, which is that important restorative sleep phase. Be mindful that if you choose to use THC in edible form, consideration must be given to the way it is metabolized in our bodies through our digestive system and our liver. Since it's different when taken in edible form, the duration of action may be longer than you intend, causing unwanted side effects the next day. Studies clearly show that withdrawal effects have significant impacts on our sleep. And we know that if it's used over a long term, the body can develop a tolerance, and you may need to increase to obtain the same results. High doses of THC may also increase anxiety symptoms, which can lead to further sleep disruption. And concerning research recently released in the Canadian Medical Association Journal showed that the use of cannabis in any form among adults younger than 45 doubled their risk of heart attack. It is important to note that while medications are sometimes needed to keep us healthy, often there can be unwanted and unpleasant side effects. There are a few medications that are known to cause potential sleep interruptions, such as nightmares, difficulty falling asleep, waking throughout the night. Additionally, some of these medications have side effects that don't necessarily directly cause sleep trouble, but they can cause troublesome side effects that often keep people awake, like coughs, leg cramps, or diarrhea. It's really important to tell your physician right away if you experience insomnia or any sleep disruption or any unpleasant or unwanted side effect. And please note, Even if you are experiencing side effects, do not stop taking your medication. Speak to your doctor and pharmacist about appropriate alternatives, or they can work with you to change the timing of your dose, which may decrease the impact on your sleep. It is important to ensure that you remove distractions when you're trying to get a good sleep. So this may include any physical distractions, such as your phone lighting up with a message, or even your dog jumping on your bed. Also consider mental distractions. If you're having difficulty falling asleep due to worrying thoughts, try scheduling a time earlier in the day to write down all your worries, your to-do lists, and other mental distractions. Be mindful that in order to facilitate the best quality regular sleep, your bed should only be used for the 3 S's: sleep, sex, and sickness. With more people working from home, we've noticed that some people have found it more inviting to work from their bed. This really should be avoided. All activities other than the 3 S's should be practiced outside of the bed to really reserve this space for easy sleep. Now you may say, Karma, using my device helps me relax. Well, it's recommended that you end your screen time 30 minutes to 1 hour before bed. This allows the brain time to relax and settle feelings of emotional stimulation that we might be feeling after scrolling through Instagram. Additionally, exposure to blue light from phones, tablets, laptops, even TVs suppresses that production of melatonin. If you choose to sleep with your phone beside your bed, consider setting your device to night mode or do not disturb to minimize those notifications and distractions. What if you find yourself waking throughout the night? Now, this is a normal part of sleep patterns. In fact, most people experience varying levels of sleep and wakefulness as they sleep. What to do though if you wake up and you're having trouble falling back to sleep? Well, first, it's important to determine if your body has signaled you to wake due to a physiological need, such as needing to empty your bladder or address some chronic pain. Secondly, try not to focus on your clock or keep checking your phone to see how long you've been awake. This can increase your anxiety and your worry about not sleeping. And of course, the light from your screen can make your brain feel more alert. And finally, if you find yourself lying awake for longer than about 20 minutes, get up. Go to a separate room and try one of those earlier strategies that we talked about for relaxation. It may be helpful to track these strategies using a sleep diary. And one was sent for this. I'm not sure if it went out with the invitation, but I'm happy to send it along. And you can use this diary to assess your sleep quality as you implement the sleep strategies that are outlined in the diary, such as avoidance of caffeine and alcohol, introducing a snack before bed, including relaxation techniques, and monitoring your bedroom temperature. In this way, you can see which strategies are helpful and which maybe not so helpful in improving your sleep quality. If after trying these recommendations, you find that you are still struggling with falling asleep, remaining asleep, or early or late waking, it is important to talk to your doctor. Sleep interruptions can be a symptom of an underlying medical condition, so it's really important to discuss sleep issues with your physician. And lastly, let's take a moment to breathe. Breathing deeply activates that parasympathetic nervous system, reducing stress, aiding in digestion, and facilitating weight loss if that is your goal. Difficulty falling asleep, staying asleep, And interruptions to regular quality sleep can certainly impact our mental health. It is so important to reach out and talk to someone if you're struggling with overwhelming feelings of stress, anxiety, insomnia, or body image issues. Attending to both the body's mental and physiological needs is paramount in establishing a positive relationship with food and in improving your sleep. Hopefully, this brief information session has given you a taste of the food, mood, and sleep connection, and will help you to be mindful of the choices that you make, the foods that you prepare, and remind you to be gentle and compassionate with yourself. Thank you.
So I'm going to apologize in advance because the dog is losing it as you finished. He's been quiet the whole time. So that was absolutely amazing, Carmen. Thank you. Are there any questions? I haven't seen any pop in yet, but I would love to open it up to questions. If anyone has questions for Karma, you can throw them in the Q&A or in the chat and I will get them her way. So just give people a minute in case there's any that come through. Okay, we got a couple coming through. So the first one was, how many hours of deep sleep should you get on average? How many hours of REM?
Right. So that's great. A great question. So for adults, we minimum of 5 hours of good quality sleep to 7 hours. And of course, when we touched on shift workers, it varies. So that's kind of the standard that we'd like to hold out. And REM sleep varies, you know, between how we're feeling and how our quality of sleep is. But it's important that we allow our bodies time to enter into that sleep phase. I see another question here about accurate sleep apps. And actually, we talk a lot about sleep apps because one of the number one recommended tools for helping deal with insomnia is sleep restriction. And in order to kind of work on sleep restriction, our starting point is we need to know how many hours of sleep you're getting. So how accurate are the sleep apps? Pretty accurate. I would encourage using them because it gives you a good baseline to see how many hours of sleep you are actually getting. So I encourage people to use them.
Oh, that's awesome.
Yeah.
The other question that we have is, how does yoga fit into sleep routine? Does it count as exercise or not?
Good question.
Great question.
It probably is like dual benefit because it has that calming meditative effect, but of course it does release some of the serotonin and the endorphins as well. So if you're going to engage in yoga, I would encourage you to do it earlier again so that you have that double benefit of the melatonin release later in the day when you want to plan for sleep.
Awesome. Those are all good questions. Are there any other questions out there? Maybe not. Maybe. Oh.
Nope.
No. Kendra, I think a lot of us are.
Yeah. Kendra, I'm sorry. At first I read that and I thought it said I'm falling asleep. And I said, oh no. The good news is that it can be something that you work on. And remember, just because you're experiencing poor sleep right now, it doesn't mean that this is a long-term thing. So you can adjust small strategies within your routine, and hopefully it does improve and work on your sleep. So I would encourage you to continue trying. And if you're really struggling, please talk to your physician about it so they can rule out other causes.
Awesome. We had another question come through asking about Christine's son's getting leg cramps at night.
Okay. So of course I can't diagnose. My first thing is going to say that you've talked to your son's physician about what he's experiencing, because it can be an electrolyte imbalance, it can be growing pains, it can be a number of things, side effects from medication as we talked about. So, but what I will validate is that they can be very debilitating. So really validate for your son that they're very painful, and really they should be explored.
Awesome. Are there any other questions out there before we wrap up for today? Okay. Karma, that was absolutely incredible. So much information and so much covered in 45 minutes, which was amazing. So thank you for that. Everyone who attended, thank you so much for attending. As always, we will send an email out to the attendees with the information that was presented today so that you have that. And just so everyone is aware, we're taking a bit of a summer break for Exemplify. So we'll be back in September with the series, just with vacations and stuff in the summer. We figured it was better just to take a little bit of a hiatus. So we'll be back in the fall with events again. So stay tuned for that. And yeah, Karma, like I said, thank you so much for all of the information today. We're really grateful for you and for our relationship with Inkblot. If anyone's looking for more information about Inkblot as well, if you're a client of SelectPath, definitely reach out to us and we can have that conversation. And even if you're not a client, we can still have that conversation with you. So definitely reach out and we can give you more information about the amazing services that Inkblot offers. So
thank you.
Awesome.
Thank you so much, Melissa. Thank you, everyone.
Thanks, Karma. Have a great day. Bye, everybody.